Hi, this is Dr. Frank with the Church of Rational Truth. Today we're going to do a lecture that was actually brought up from a subreddit thread that I saw on Our Medicine, and it was about vaccination exemptions for people with religious beliefs. Basically, what happened was I think it was Washington or Seattle or one of those municipalities was allowing people to get religious exemptions for COVID vaccinations for school only with a certain form filled out by their doctor. Basically, they had to go to their doctor, give them this form, have the doctor sign the form, and many people on the subreddit took the opinion that it would be unethical to sign this form because they believed it would be enabling their patients to make a poor medical decision, that they didn't believe that it would be appropriate for them to be exempted from vaccination, that they thought it would be dangerous, it would be allowing other people to be exposed, and that they thought it would be very unethical if they signed this form because it would be like them saying it is fine to go unvaccinated. Uh, the issue about this was, is that the case, or is this a deeper meaning? Are you actually giving someone the okay by signing this forms? A lot of this got into the semantics of it, and I think this kind of was important, the semantics of the form. I usually don't like to be very pedantic with things, because I usually think that a lot of things don't need very, very strict definitions or getting into the minutia of it. But this one, I think it was kind of important to actually see what the form was asking for, because that had a big impact on what the meaning of it was. What is the meaning of seeing this doctor to sign this form? Is it the doctor actually giving the okay that says medically it's fine for this person not to be vaccinated? And which, if you think about that, is kind of ridiculous. Why would a doctor need to sign off that your religious beliefs are valid? That's kind of what a lot of those doctors took it as, but when looking more deeply into what that form actually stated, it seems like that wasn't actually the case. The form wasn't saying medically that this person, as a medical professional, you say that this person does have a religious belief that means they shouldn't be vaccinated. It wasn't saying that at all. Basically, the form stated that I, as a medical professional, have discussed the risks and benefits of being vaccinated and not being vaccinated with the patient and the family member of the patient, since usually it was someone who is a minor or underaged, and that this has been discussed with them, and basically that's it. That is the statement. You have come and you've had this discussion about what are the risks of not being vaccinated. That to me is very, very different, because that is not stating that you agree to this. It is not stating that you want the patient to do this. If anything, it had a much very different meaning to it. It sounds like the meaning behind that form wasn't to say that the person is justified in that decision. It was more that form was meant to be a way of proving that someone at least had talked to someone with appropriate medical training to be educated and informed of their decision before they decided to make that decision to go unvaccinated. That is a very different thing. That, I would say, is not enabling a patient. A patient has autonomy, and a patient has the ability to make a wrong decision or a bad decision about their health. I think our roles as medical professionals is not to be paternalistic, is not necessarily to force a patient to do the right decision. We live in a free country. America is very pro-freedom and pro-choice in terms of many things, in terms of our personal liberties. I'm not going to go into I'd use the term pro-choice. That's probably not the best term. But we pride ourselves on our liberties, our freedom, and our freedom to be able to handle our children, the way we want to raise them, with very few limitations up until the point of getting to child neglect and abuse. So this, to me, did not seem like something that would be actually enabling it. Many doctors even said they would flat out refuse to sign these forms, and I actually think that might be unethical. A patient came to you for education. A patient came to you to ask for something that was just knowledge, and all you were signing off is whether you actually gave that knowledge or not, or whether you spread that knowledge or tried to have a rational discussion with the person. Flat out refusing, I would argue, doesn't do anything to help your push towards vaccination. Because, one, you're dealing with a population, if we're talking about people who are anti-vaccination in general, they're usually more on the religious side. They usually are more afraid of modern medicine. They don't usually trust doctors, like doctors, or they think there are ulterior motives in medicine. If you are taking an adversarial position to someone who's already standoffish and tell them, no, I am not going to do this because I know what's right for you. You need to get this vaccination, and there's nothing I'm going to do to help you not get that. That's only going to entrench the other party even further. They're not going to trust you. They're not going to listen to what you say. They're not going to take your advice. And if anything, you're going to push them further down that road of distrust of the medical society, of the medical establishment, because why would you trust that person? Why would you trust someone who is standoffish towards your beliefs? If you've seen this in debates, or the difference between a debate and an argument, people usually only get further entrenched in their own opinions. It's not a back and forth, it's not an educational discussion, it is two people yelling and only getting further and further apart on their beliefs instead of actually coming together and having a meaningful cross-communication. So if you take that adversarial position and just say, you're either going to do it or you get out of my office, I'm not signing that form, they're not only going to not rethink their own position, they're not going to be open to a discussion about it, they're only going to get further entrenched into their own decision. And now, what I've seen a lot of times is people start going into pseudoscience or false medicine, almost to the point of witch doctory, where they have found the person who is going to abide by their beliefs. And so instead of actually keeping someone into practical medicine or normal Western medicine, you might push them further into pseudosciences, like many things that are, I don't want to say all naturopathy, but many naturopaths dabble somewhat in pseudoscientific things, some homeopathies, pseudoscience. It's going to push them further into a provider who does dabble in those things, who does not follow Western medicine, who does not actually look at things rationally. You're just going to push them into the arms of someone who already has their own beliefs. And what you're doing is you're creating a offshoot of society that is now kind of rogue. They're going to have their own beliefs, they're going to follow it, they're going to make their own echo chamber, because they are just going to reject your reality and they're going to create their own that goes with their own preconceived notions. That is very dangerous. That is probably ending up doing much more harm than good, because now you've just further alienated someone who was already feeling alienated with Western medicine. What I would do, and what I've done with my patients, because I have many patients who are anti-vax or do not trust vaccines, I keep it to facts, rationality, and I just explain to them how it is. And when it comes to a form like that, I think your job is purely to be an unbiased source of education. Yes, clearly the statistics would probably say for the vast majority of people it is worth it to get vaccinated, because the risks of getting vaccinated are much less than the risks of getting COVID or whatever disease you're vaccinating against. But many lay people don't understand that, and the best you can do is try to explain it in simple terms. And what I've done with my patients, I don't force them to get it. I don't tell them they're dumb or wrong. I tell them about, this is a game of statistics. Yes, absolutely, some people will have side effects, and some possibly even fatal from getting a vaccination. It is statistically possible. There is a reason to have a slight fear with getting a vaccination, because it's not 100% benign. But then again, nothing is. You could choke on a vitamin pill, because there is risks associated with living. So I do somewhat validate their fears. They're afraid because they don't know what's going to happen with this barely tested vaccination that only has a few clinical trials, that has only existed for a matter of months or years. So I do validate them. I do say, yeah, there is some reason, there is some unknown. It is not 100% fake, 100% safe, but on the same respect, it probably is much safer for most people than actually getting COVID, especially getting COVID being unvaccinated. And I talk to them about the different risks. I go, honestly, the older you are, diabetes, COPD, immunodeficiencies, I go over those risks and I talk about what risk-benefit analysis is, because many times these people don't have any understanding of risk-benefit analysis. They don't understand why doctors will push for these things, because they can't look at those numbers and understand what it is. The other thing is they get blinded by their own bias. They see the one person who has died, or at least the report of someone who's died because of being vaccinated. They hold on to that very strongly because it already correlates with their belief. It takes a lot of other information that goes against that to actually let someone change their opinion. So what I would do is I would rather keep them in my practice, even if they're doing something that I don't necessarily agree with, because that way I can still kind of act as the voice of reason, and I would hope that with eventually enough time, they would see enough data to change their minds. It's not going to happen to everybody, but I'd rather not alienate them further and push them further down that rabbit hole of pseudoscience or false science. Uh, the other part I brought up is we do things all the time in medicine that allow patients to make bad decisions, and we don't act paternalistic about it. If you have a patient, I've known at least one doctor who has fired all of his smoking patients who don't try and quit, but that's not very often. This to me would be the equivalent of firing all your obese patients, firing all your smoking patients who aren't trying to quit or not working hard enough to lose weight or not treating their diabetes. Would you fire all those patients if they're not trying hard or they're not taking their blood pressure medicine? You probably wouldn't. You know they're not getting standard care. You know some people don't want to take a statin because they're afraid. But most doctors won't fire them because they'd rather have them have subprime care and have them have the option of getting better care than to end up firing them, and then who knows who do they go to for their medicine in the future. They might go to someone who's completely unqualified for medical care. They might start distrusting medicine in general. And that's really not what we want. I think patients should have the right to make the wrong decision about them and their children up to a point. Everything's relative, but up to a point, they're in charge of their children, and their children kind of have to deal with the consequences of their decisions. So we should not force them to make those. They should be allowed to make a wrong decision, but we should be there and be ready to help them to take them off their knees if they do make a bad decision and end up getting hurt. It's not an I told you so. It is you are allowed to make your decisions on your body, and honestly, ultimately, they're the ones who are mostly going to bear the consequences. Now, that is not 100%. The big argument is, well, this is a community health issue. Yes, it is, but we should make the rules based on the community health issues as they come up. This, I would say, is if you have the issue of community health, you should put laws in place where they would be legally, financially, criminally liable for spreading these diseases. If someone refused to get vaccinated but then spread COVID to a school or workplace, they knew the risks, they possibly could hurt someone, that could be arguably considered manslaughter in certain situations. If you refuse to get your vaccinations, the school should be able to say, sorry, this is now a public health concern. You can't come to this school. You're going to have to find some alternative method. I think that's completely fair. This way you try to find a nice balance between allowing patients and families to have their autonomy in terms of their medical decision making, but yet limit the risk for the public good in terms of now allowing unvaccinated people to possibly spread diseases, which absolutely will happen with a large enough population that's unvaccinated. So you have to kind of find that middle ground where you can try to get enough patient autonomy while still trying to protect the public space. That's it. I don't want to drone on too long because this video is already getting to like 12-13 minutes long. I could probably go on much further about this, but I do think that it's probably not the best to draw a hard line and alienate those patients. If I'm going to do a too long didn't read, that's probably what I would say for this topic. Old news, the two things we're going to vote on are between the church fund or going back into the general fund, so we will do that this week, and we'll talk about the results for next week. And that will be it. This is, once again, Dr. Frank with the Church of Rational Truth, signing off. Thank you so much for watching.